Here's something most men carry quietly their whole lives: a nagging uncertainty about whether they're truly satisfying their partner. And most women, they never say a word. Not because it doesn't matter, but because protecting his feelings feels easier than starting that conversation. So she stays silent. She adjusts her expectations. And slowly, without either of them fully realizing it, that part of the relationship fades into routine. I've seen this pattern hundreds of times in my clinic, and what breaks my heart every single time is how unnecessary it is. My name is Dr. REENA. I'm a board-certified urologist with over 12 years of clinical practice specializing in male and female reproductive and urinary health. I study nerve pathways, hormonal responses, and vascular biology, not in theory, but in real patients with real relationships on the line. What I've learned after working with thousands of couples is this: the problem almost never comes down to age, ability, or attraction. It comes down to one thing: missing information. The kind of information nobody ever sat you down and gave you until today. What I'm about to share isn't entertainment, it's practical, biology-backed education that has genuinely changed relationships, including marriages that were decades old and quietly falling apart. If you've ever looked at your partner and wondered whether she's truly satisfied or just being patient with you, stay with me. You're about to understand things most men never figure out. Hit like if this is already speaking to something you recognize. Drop a comment and tell me where in the world you're watching from. I read every single one. And if you're new here, subscribe. Every week, I bring honest, research-backed conversations about men's health that most doctors won't have with you. Now, 9 things I want every man to understand. Don't think of them as techniques. Think of them as a language. One your hands, your voice, and your presence can all learn to speak. But before tip 1, I need to correct a belief that quietly sabotages most men before they even begin. There's a widespread assumption that a woman's breasts are primarily a visual experience, that touching them is more symbolic than meaningful. Biologically, this couldn't be more wrong. The nipple and areola contain one of the highest concentrations of sensory nerve endings anywhere in the female body. When stimulated properly, those nerves send signals to the exact same region of the brain that processes genital sensation. For a significant number of women, stimulation in this area alone can produce a full, complete climax. Beyond that, getting this right triggers a release of oxytocin, the bonding hormone, which lowers cortisol, relaxes the pelvic floor, and shifts her entire nervous system from guarded and tense to open and receptive. In other words, when you understand this area, you're not just touching her body, you're changing her biology. You're creating the neurological conditions for a level of pleasure most men never give their partners access to. So let's get into it. Tip 1, ask before you assume. This one costs you nothing and changes everything. Before you touch her, ask with genuine curiosity, not nervousness or apology. What feels good to you? Do you prefer lighter touch or more pressure? Are there spots that feel better than others? That question, asked calmly and with real interest, does something powerful before a single touch has landed. It signals safety. It tells her that her experience matters more than your performance. And when a woman feels genuinely safe, her body responds differently. Cortisol drops, oxytocin begins to rise. She becomes physiologically more receptive before anything else has happened. I had a patient, 61 years old, married over 30 years, who came to me because the intimacy in his marriage had quietly disappeared. In 3 decades together, he had never once asked his wife what she liked. He'd repeated the same patterns, assuming her silence was approval. It wasn't. When he started asking, just asking, she told him it was the most connected she'd felt to him in years. Not after a new technique, after a question, start there tonight. Tip 2, travel slowly, arrive late. Most men treat the breast like a destination. They head straight there within the first few moments. And in doing so, they skip the biological preparation that makes everything else work. Start at the edges. Warm hands along the collarbone. Slow fingertips tracing the outer curve of the rib cage. Breath at her neck. What you're doing biologically is activating her parasympathetic nervous system, pulling her body out of the tension of everyday life and into genuine physical openness. By the time you arrive where you're headed, she's already responding. She's already halfway there. A small amount of fragrance-free, skin-safe lubricant on your hands eliminates friction and allows your touch to glide rather than drag. This one small detail changes the entire quality of the experience. Go wide. Start far from the center. Let anticipation build until it's almost unbearable. Tip 3. Cradle, don't grip. This is where most men's instincts work against them. They grip. They squeeze with fingers. They apply pressure the way you'd hold something you don't want to drop. Her body wants the opposite of that. Use the full palm. Support the natural weight of her breast with your whole hand rather than grasping with your fingers. Alternate between gentle, intentional compression and complete stillness. Moments where you're simply present, holding her, not moving. The nerve endings in breast tissue respond most powerfully not to constant pressure, but to variation, the shift between movement and stillness, the contrast between warmth and the brief coolness when your hand releases. Watch her breathing. That's your real-time feedback. When something lands right, her breath deepens, slows, loses its control. She leans into your hand. These signals are unmistakable once you know what you're looking for, and they'll guide everything else you do. Tip 4. The areola deserves your full attention. Most men fixate on the nipple as the target, and in doing so, they completely bypass a region that is, for many women, even more sensitive. The areola, the textured ring surrounding the nipple, is densely packed with nerve endings that respond specifically to light, slow, circular stimulation. When you trace lazy spirals around the outer edge, moving inward gradually but never quite reaching the nipple, you're creating something neurologists call anticipatory arousal, a building awareness, an almost unbearable wanting that makes the eventual touch of the nipple feel like electricity rather than simple contact. Use just the tip of one finger. Move slower than you think you need to. Resist every urge to rush to the center. What most men think of as building to the real thing, this is the real thing. Tip 5. The dimmer switch. Picture a dimmer switch, not a light switch. You don't flip it from dark to full brightness. You rotate it slowly, watching the room respond as you go. That's your model for everything that follows. Start with the lightest possible touch. Almost breath before contact. A featherweight presence. Then, only as her body responds and invites more, increase by the smallest possible amount. A gentle rolling motion between the pad of your thumb and the side of your index finger. A soft press, then a release. A pause. What you're building is a neurological crescendo. Each small increase is felt against the baseline of what came before, and the contrast between those levels is what creates intensity. Never pull sharply, never jump to pressure without invitation. A small amount of lubricant on your fingertips at this stage eliminates any roughness that breaks the spell. Trust this process, it works. Tip 6, your mouth is your most underused tool. Nothing your hands can do fully replicates the combination of warmth, moisture, and graduated pressure that your mouth can deliver. And most men rush this in a way that misses its potential entirely. Start with breath alone, warm, slow, directed at skin you've already warmed with your hands, then lips, unhurried, light, tracing the same spiral your fingers mapped around the areola. Gentle suction building only when her response invites it. If you choose to introduce the lightest graze of teeth, test the pressure first on your own forearm. This isn't a quirky suggestion, it's precision. Your forearm gives you accurate sensory feedback before you apply that pressure somewhere that matters. And throughout all of this, watch her face as much as her body. Her face tells you the truth even when she's making no sound at all. Tip 7. Your voice and your breath matter more than you think. This one surprises men every time I mention it. Your voice used well is a sensory amplifier. Quiet words spoken close to her skin, real, specific, present observations, not rehearsed lines, shift the emotional temperature of everything you're doing, what you're noticing, what you're feeling, what she means to you in this moment. The difference between a scripted compliment and something genuinely felt is something her nervous system picks up immediately. Then there's breath. When you slow your exhale and make it audible, she begins to mirror it without realizing it. her nervous system responds to the cue of calm. And that physiological shift, that shared rhythm, creates the neurological conditions for pleasure to deepen in ways that technique alone cannot reach. You're not just touching her, you're breathing with her. That's one of the most intimate things that exists between two people. Tip 8. Layer sensations, change one thing at a time. When breast stimulation is combined with consistent, focused attention elsewhere, the total effect is significantly greater than either would be alone. The brain processes multiple pleasure signals simultaneously, and the result compounds. But here's the critical rule: change only one variable at a time. If your hand shifts what it's doing, keep everything else constant. Her nervous system needs time to track and lock onto each sensation. Change too many things at once, and arousal disperses rather than builds. Patience here isn't restraint. Patience here is the skill itself. Tip 9. Temperature contrast. Only with full openness from both of you. Alternating warmth and coolness on sensitized skin can dramatically heighten nerve response. A warm palm followed by slightly cooled fingertips. The heat of your breath followed by a brief exhale of cooler air. The nervous system interprets these contrasts as novelty, and novelty sharpens attention, which sharpens sensation. If you choose to bring in any external tools or devices, begin at the absolute lowest intensity and stop immediately at the first sign of discomfort. Skip this tip entirely if there's any pregnancy, injury, or medical concern involved. This tip is last for a reason. Everything before it is the foundation. This is just one final room in a house that has to be built correctly first. Here's the framework I want you to carry with you. Ask before you touch. Start wide and arrive late. Cradle with your whole hand. Trace the areola before the nipple, slowly and deliberately. Build intensity like a dimmer switch. Bring your mouth in with warmth and patience. Let your voice and breath be part of the experience. Layer sensations and change only one thing at a time. And for those ready to explore further, temperature and tools only with full mutual enthusiasm. When it's over, don't move. Stay. Hold her. Let your breathing slow together. More women than you'd expect will tell you honestly that this moment, the quiet stillness after, is the most important part of everything that came before it. I want to speak directly to the men watching this who are feeling something complicated right now. Recognition, maybe. Regret about years of not knowing what you didn't know. I want to say this clearly. There's no shame in that. Nobody gave you this information. You didn't fail her. You simply weren't taught. The men I've watched rebuild their intimate lives weren't in their 20s. They were in their 50s, 60s, 70s. They decided it wasn't too late. Every single one told me the same thing, that what they found on the other side of that learning was deeper than anything they'd had before. That is available to you, right now, today. The patience you've built, the love you've carried, the depth that comes from years of genuinely knowing another person. Younger men simply don't have those gifts yet. Maturity doesn't diminish intimacy, it refines it. Start tonight with tip 1. Just the question, just genuine curiosity. Let everything else follow from there. If this helped you, hit like and subscribe. Share it with a man in your life who needs to hear it. And tell me in the comments, which of these 9 tips surprised you the most? I'm Dr. REENA, your urologist, your straight-talking health and intimacy partner, and someone who believes completely that your best years of connection are not behind you. They're ahead, and they start with what you just learned. Take care of yourself, take care of her, and I'll see you in the next one.